Today we are at the Hamilton Back Clinic located on the Stony Creek Mountain. Hey folks, I'm Mike Fortune, and yes, I'm in the undershirt today because I'm going to be getting some work done on my shoulder. The gentleman doing that work, Dr. Anthony Lombardi. Doctor, great to see you today.
Thanks for having me, Mike.
It's always a pleasure having a chat with you.
Same here.
Now, we've talked about my shoulder and some of the aches and pains I've been having, but in general, what is chiropractic?
Well, chiropractic is the assessment and treatment of muscle and joint-related injuries using a variety of manual techniques to treat those problems.
And these problems can be in your wrist, your elbow, your shoulders, your ankles. I guess it depends on the season, really.
It really does. Like in the spring, we get a lot of baseball players coming in with shoulder problems. In the summer months, we get a lot of soccer players. And then through the winter, we get a lot of people who hurt their back shoveling snow and just ice or snow-related injuries.
So let's get to the shoulder injury. It feels like it's a torn rotator cuff. I have no clue, but I know it's limiting my movement, even when I'm driving a car, for crying out loud. Well, what is it? What is the first step when you're assessing any type of injury?
First step, and we spoke earlier in my office, we took a history. So
Yeah.
it gives me an idea on how you think it happened and the general history of the shoulder, how long you've had it for. And then I like to do the assessment, which consists of checking the range of motion, seeing how well it moves in comparison to the other side, see how well the elbow moves and the wrist, and then doing some strength testing to see how strong you are, because those give me an idea as to what's wrong, but also it's a good benchmark to have after we treat it to see if those benchmarks have improved, if the strength has returned to guide your healing.
And these assessments are done for any patient that comes in, depending any type of injury they have.
Correct. We need to do a full assessment first before we treat using a variety of techniques, whatever it is I think will work best.
So what is it that we're doing right now?
Right now I'm just checking your range of motion. I can tell just from feeling the tissue that there is some sort of restriction. There's some scar tissue buildup, meaning that there has been an injury here has been going on for a long time, regardless of how long you had the pain. And what I do now is do some muscle testing. So I'm going to push down, you're going to push up. Go ahead. All right, and we can see it's definitely weak there, and you may even have some pain. Go ahead, push up here. So this is just a general scan, not as bad there, of the deltoid muscle, which is the major muscle in the shoulder. And I always like to follow up with a variety of tests. I push down, you push up. And this test here, see, it's very weak, you have some pain.
I felt a lot of pain up in the neck.
In the neck, and also your shoulder blade, which is the bone at the back. The shoulder blade stabilizes the shoulder, so this shoulder does not have any stability right now.
Okay.
So, and that's not that uncommon with any type of rotator cuff injury.
So while you continue to work on the shoulder here, when we come back to Hamilton Life, Dr. Lombardi hopefully will have me back up and running fairly soon. He's going to keep working on my shoulder. Stay tuned to Hamilton Life, and we have more things that the Hamilton Back Clinic can offer you. We're back here at the Hamilton Back Clinic, and a lot of the work that's being done on my shoulder is fantastic. And it's so true what they say. The neck bone's connected to the shoulder bone, which is connected to the elbow bone. Well, you know the rest of the song. And my whole right side is starting to feel much better, thanks to Dr. Lombardi. Doctor, we talk a lot about what we can do to prevent some injuries in regards to stretching, both before and after. We're getting into, we're going to be raking some leaves, shoveling some snow soon, I'm sure. What are some things that people can do to help with their necks, their shoulders, and their backs?
Well, of course, Mike, there's some general stretches, very easy stretches that can be done to stretch the neck, the shoulders, the leg, the pelvis, whether it's raking leaves or going to play a pickup game of touch football, things like that. So there's many easy stretches that they can do. Of course, it's all according to their limitations. So one thing I would recommend is if they see a chiropractor, a physiotherapist, or even their medical doctor, their health practitioner can provide them with those stretches and show them how to do it correctly.
Give them a stretch, do it properly. That's the key thing. I see so many guys at baseball tournaments, they think they're stretching, but it doesn't look like they're really doing anything.
Yeah, and a lot of times too is those same weekend warriors, as they're called in the industry, they just, they stretch for those, 10 seconds before they play baseball, and they don't do another thing all week, and that's how you get hurt. That's how you set yourself up for injury.
So we've talked about, you mentioned physiotherapists, you're a chiropractor, and we've also talked a little bit about doctors. Where does each one kind of stand in regards to what is the best technique to get a shoulder fixed? If I had gone to my doctor, would he just prescribe some medication? Physio guy would do something else. You're doing something different. Where does it all kind of stand?
There's definitely the discrepancies. Medical doctors are more likely to use conventional approaches, send to an orthopedist, maybe do an injection of cortisone. Physiotherapists would focus more on, let's say, strengthening the tissue along with bringing down the inflammation. And chiropractors, like myself, the more progressive chiropractors, will use a myriad of techniques, especially using manual work with medical acupuncture, focusing on improving joint mechanics. Which is right, which is wrong? Well, that depends on who you're asking. So whatever's best for the patient is the best approach, in my opinion.
And then, of course, you're working on my shoulder now. How often would you like to see me or any patient come back, depending on their injury?
Well, this is the first time I saw you. There's a lot of scar tissue buildup here. So initially I see patients a couple of times a week for 3 weeks, and then I reassess. It doesn't seem like a lot of time, 6 visits, but in that time we can make significant progress, and we'll both know if the treatment, if the approach is helpful. After that time, we do some supportive care based on an individual basis.
You continue to work on my shoulder here, and when we come back, I believe we're going to be doing a little bit of acupuncture, something I've never experienced, but I'm looking forward to try. So stick around to Hamilton Life, and hopefully the shoulder will be back up and running soon.